interventions. In the meantime, an endocrinologist in the University of Uyo Teaching Hospital UUTH, Dr. Ubong Umoren, has called on the general public to regularly check their glucose levels so as to know their diabetes status. Dr. Umoren made this known in an interview with Spectrum Television in commemoration of the World Diabetes Day celebrated today. The endocrinologist, who disclosed that about 85 to 90% of people live with type 2 diabetes, highlighted some risk factors to include sedentary lifestyle, obesity, among others. According to him, consumption of food with more protein and fiber, as well as reduction of alcohol intake, will help prevent or manage diabetes disease.
The theme for the World Diabetes Day, which is 14 November every year, has been access to diabetes care. The sub-theme for this year is know your risks, know your response. That risk basically applies to type 2 diabetes, which is actually the commonest form. About 85 to 90% of people that have diabetes have type 2. So the idea is to let access to diabetes care basically mean access to testing, regular testing, access to medications, understand, access to support from the family, the doctor, and even the government, understand. So basically access to care is an all-encompassing word that talks about access to all aspects of diabetes care, which some people include testing, even getting to make a diagnosis. And for example, now 1 in 2 people that have diabetes don't know they have it. So access to testing is very important. We people get to at least have a regular fasting blood glucose check. When you have numbers above 7, you can now decide, okay, this patient has diabetes, you can now start treatment. Access to education, very important to understand, is also an aspect of it. The commonest risk factors include sedentary lifestyle, physical inactivity. People sit in one position. People at the executive can sit in a position for 8 hours, they're not moving around. Understand, that is one. The other one is somebody that's overweight or obese. Overweight and obesity is one of the major drivers of type 2 diabetes in our environment. Family history of diabetes is also very important. Understand, if somebody in a first degree relative, for example, now, if your mom has diabetes, your mom is your first degree relative, your dad, your sisters, your siblings, those are your first degree relatives. So if any of them has had diabetes, it increases the risks, understand, of another person that is related to them coming down with diabetes. Excessive alcohol consumption, use of a lot of processed food, shawarma, pizza. People eat a lot of things. Most of these processed food that is safe in, most of them, sometimes they put a lot of salt to preserve.